Hi guys, myself Dr. Amir, and in today's video we are going to discuss the questions of medicine which were asked in recently concluded NEET PG exam. So we will discuss these questions one by one, and we will also discuss explanations of these questions. So coming to the first question was ECG findings were given with U wave and ST depression, and what is the cause? So prominent U wave and ST depression present in hypokalemia, and other findings of hypokalemia are inverted T wave, decreased T wave, or absent T wave, along with increased amplitude of P wave with prominent U wave and ST depression. Another question was an ABG findings were given in which pH was 7.2, PO2 was 71, PCO2 was 85, and bicarbonate was 35. So what is this? You can easily answer this question. It is respiratory acidosis because PCO2 is high and pH is low. And this is explained here. There's two types of thing. Either it is acidosis or either it is alkalosis. Major difference is pH. pH is if less than 7.34, it is acidosis. More than 7.34 or more than 7.44, it is alkalosis. So first difference is this. You can rule out two options on the basis of acidosis and alkalosis only. Then you have to see the change, which is changes whether due to PCO2 or whether due to bicarbonate. If it is due to PCO2, then it is respiratory, and if it is due to bicarb, then it is metabolic. So in this question, changes due to PCO2, so it is respiratory acidosis. Another question, there is a picture of chest X-ray, and you have to identify the condition and have to identify the management. So in this condition, you can easily see it is left-sided pneumothorax. So answer is immediate chest tube insertion and drainage. Another question, a 25-year-old patient with RTA, 2 days later he has developed dyspnea, petechial rest. What is the cause? So in this clinical scenario, this is a case of fat embolism. Another features of fat embolism, it is common after road traffic accidents. It is common after post-operative conditions, generally develop after 12 to 72 hours, and present with sudden onset dyspnea because of emboli to the lungs, or cognitive dysfunction because of emboli to the brain, or because of petechial hemorrhage due to emboli to the skin circulation. Another question was a young male with irregular pulse with pulse deficient of 20. So what will be the JVP finding? So this is the case of atrial fibrillation, and JVP finding in case of is in atrial fibrillation are absent A wave. Then coming to another question, a confused patient brought to emergency with nausea and vomiting. What will be the immediate management? So there will be many causes of nausea and vomiting and drowsiness, but in this question you can see options are around IV fluid and insulin. So probably this is a case of diabetes. So in diabetes, this condition happens in diabetic ketoacidosis, and treatment of diabetic ketoacidosis is IV fluid with regular insulin. One patient came with COVID with loosening of teeth and hemifacial pain and previous history of COVID-19. So what will be the cause, and what will you do to confirm your diagnosis? So this is probably a case of mucor, because post-op patients में post-COVID patients में mucor वो काफ़ी common रहा है, और mucor को diagnosis करने के लिए we have to go for nasal swab for mucor. And another features of this infection are ये aggressive होता है, black nasal discharge के साथ present करता है, और जो facial complaints हैं, loosening of teeth है, hemifacial spasm है, या pain over the face है, these are present in this condition. और treatment जो है इनका वो है amphotericin B. Which of the following is not found in meant-to-be? So you, in all of these options, you can easily exclude parathyroid adenoma, because parathyroid adenoma are not part of meant-to syndrome. Meant-to syndrome, meant-to-be specifically, is present with medullocarcinoma of thyroid, with pheochromocytoma, with mucosal neuromas, marfanoid habitus, medullated corneal nerve fiber, and megacolon. There was a question, present with manifestation of rheumatic fever but no carditis. What will you suggest for secondary prevention? So mota if there is presence of carditis, then treatment should be continued for minimum 10 years, and if there is no carditis, then prophylaxis penicillin should be continued for 5 years. Another question was, an obese patient come to an OPD with dark patches on the neck. What could be the diagnosis? So, dark patches, dark patches with obesity. These are common features of metabolic syndrome or syndrome X. So, in this you can see there is centripetal obesity, and there was patches present around the neck or etc. Another question was on iron toxicity. There is a scenario of iron overdose. So, and what is the management of iron overdose? So, you all know management of iron overdose is defruxamine. What other things iron can cause? Secondary hematochromatosis. It is a long-term illness due to increased iron consumption, but in short term, it can cause acute toxicity. And treatment of acute toxicity is defruxamine. Which of the following? Another question was, which of the following is best associated with hyperkalemia treatment? So, treatment of hyperkalemia you can give. You start the treatment with calcium gluconate. Antagonist is calcium gluconate. Another things which we use is insulin drip, and because insulin shift extracellular calcium, extracellular potassium into intracellular compartment, salbutamol nebulization, and removal of potassium either by dialysis or by binding resins. So, which of the another question was, which of the following is the primary antidote of digitalis toxicity? Antidote of digitalis toxicity is digoxin immune fab. Came in the market with the name of Digibind. And two important features, cardiac features of digitalis toxicity is paroxysmal arterial tachycardia with AB block. This is most characteristic thing, and ventricular bigeminy is most common. Treatment is Digibind, means digoxin immune fab. So the following will be best useful in acromegaly. So if medical management is asked, you can use somatostatin analog like opioids. And overall, transsphenoidal surgery is best treatment. Which of the following composition of fluid? A question was asked on composition of fluid. So I will suggest you should know composition of every fluid, whether normal saline, Ringer lactate, Hartmann solution, or plasma-lite. It is must. Another question was, an anxious mother come to an OPD with complaint of her 4-year child falling frequently and also take support while standing. Identify the condition. So falling frequently and taking support while standing probably give you a clue about proximal muscular dystrophy, and proximal muscular dystrophy in this scenario with this picture is Duchenne muscular dystrophy. Duchenne muscular dystrophy, more thing about it is more common in boys, generally progressive, generally start at the age of 4 or 5 and progress rapidly. And the last question I am discussing is this HRCD picture was given, and it is a picture of 35-year-old female presented with fever and expectoration, difficulty in breathing. So what you can see in this picture, रेडियोलॉजी से बहुत सारे क्वेश्चन इस टाइप के आते हैं, बट इन दिस यू कैन इजीली सी इट इज अ केस ऑफ लंग कंसोलिडेशन विद एयर ब्रोंकोग्राम. दिस इज कंसोलिडेशन. सो गाइज, इन द एंड आई एम वेरी थैंकफुल कि मैंने साल भर आपको सजेस्ट किया प्रेप लीडर के लिए, और आई हैव शोन यू कि मोस्ट ऑफ द क्वेश्चंस 92.5% ऑफ द क्वेश्चन वर डायरेक्टली और इनडायरेक्टली फ्रॉम द प्रेप लीडर नोट्स एंड प्रेप लीडर एमसीक्यू बैंक. 2023 aspirant, I would like to say कि your concept should be clear as most of the question are concept based. उसमें डायरेक्टली आपको नहीं देता है कि इसका आंसर क्या है, आपको एक सिनारियो देते हैं, आपको डायग्नोसिस खुद बनानी है और फिर उसका ट्रीटमेंट आपको बताना है. तो आपके कॉन्सेप्ट बहुत ही क्लियर होने चाहिए, क्लिनिकल नॉलेज स्ट्रॉन्ग होनी चाहिए, क्योंकि मैंने 17 क्वेश्चन डिस्कस किए हैं, उनमें से मोर देन 10 आर क्लिनिकल बेस्ड. एंड फॉर दिस, मेकिंग योर प्रिपरेशन स्ट्रॉन्ग and making your preparation complete, I will suggest you कि download the PrepLadder app, link is in description, and review the content. आप notes पढ़ो, lecture देखो और MCQ solve करो. If you like it, then take subscription. I'm sure you will like it. And if you then you will get extra discount. So thank you very much. and if you want we can discuss questions of another subjects also. Thank you very much.